Okay. Dave, can you verify that you can hear me okay?
I can hear you.
Great. So I'm seeing a number of people roll in. My thought here is as we've got a bunch of people joining, likely to kick things off about probably 2 minutes after the hour here. So for those joining, thank you for joining. It's 10 o'clock. We'd like to get started here around, maybe a minute or two. We have a bunch of people joining, so I just want to make sure we give enough time to admit everyone coming in. And if you don't be redundant here, folks, we're a minute after. We're going to get started here in about a minute. We had over, over 60 people RSVP for this meeting. So my team is admitting those coming in. Just want to give enough time for people to get in and get settled in. So we'll start here in just 1 minute.
We'll go back to one of these.
Okay, Dave, I think we should get started here. We've got a number of people in. I know that people still are trickling in, but want to be respectful of time. Thank you for everyone joining today. I'm thrilled, and by the way, Happy New Year. I know that kind of looking back in 2022, BRMS had a very, very successful year. Our sales were up over 200%. I was hoping, I think like many of you in the industry, that we're getting a little bit of a lull, but the truth is our activity is up, self-funding's up. If I look at our pipeline, for example, from now till 7/1, what are we, 2 weeks into the year, and we've got close to 30 opportunities that we're working on. So certainly keeping us busy. I think kind of a fun thing to share as we think about self-funding in general, before we kind of going into the presentation here, is that, in the Pacific Northwest, it's up. Historically, if you kind of go to the Midwest, for example, any group over 80 lives, for example, is all self-funded. And in California specifically, it's been kind of really overweight with fully insured. And kind of case in point, I had the opportunity to meet with the GM of Anthem just about a month ago and over dinner. And she shared with me that, when they looked at their year, even though they were 100% over goal, the outcome was 100% different than what they've experienced in the past. And what I mean by that is 80% of the production came from self-funding this year versus being fully insured. And so they're having to sort of change the way they conduct business and how they price things. So certainly want to applaud those, again, currently in the self-funded space or considering it. As we go through the presentation today, there's a vast, diverse group on the line today, ranging from executives to senior HR folks to current clients, as well as brokers that are maybe, haven't had too much experience around self-funding. So I want to make sure we're very thorough with our comments, remarks. On our invite, we didn't a lot of time. I think we've slated an hour. Ideally, what we'd like to do is present for about 40 minutes or so and leaving some time at the very end for some Q&A. I do have everyone muted at the moment, but again, towards the end, we will open it up for questions. By and large, again, the goal of this sort of presentation today is kick off the new year, kind of looking at what BRMS did from a strategic partnership perspective to do very well and see true impact. And so I wanted to make sure we kick off the new year with this subject in mind, helping kind of kickstart your year to making sure you're making a difference and helping drive and reduce spend for the groups that you manage or for the company that you might be managing as relates to maybe a CFO position. So with that in mind, I wanted to take an opportunity to kind of at least highlight, before we go into Dave and his presentation, about the integration that we have, about who BRMS is, what we do, and what makes us different. Certainly, we are excited about celebrating our 30th year of being in business. Currently, the way that I understand it from the market is that we're one of the largest independently owned TPAs in the market. And we're thrilled by that. We think that's a huge differentiator. If we think about kind of at its core as to what a TPA does, really what they're doing is looking at invoices, making sure that they're paid fair, reasonable, and accurate, right? And so with TPAs being gobbled up by venture capitalist money or by carrier money, there's always kind of this conundrum of, right, are they being really objective with the input that, that's coming in and what's being paid? And we'll kind of go into some examples of that today. So again, being family owned and operated and not having to report to VC money or carrier money is a big deal, and we're sought after just because of that. So again, BRMS is growing. If you wouldn't mind going back a slide there, Dave. Sorry. BRMS is growing. We currently manage about 140,000 employee lives underneath our self-funded plan. BRMS has 3 different office locations. Our largest one here is in Folsom. Many of you might be familiar with Johnny Cash, not too far from where he did some prison time, but we also have a wonderful office over in Fresno, kind of dealing with a lot of our ag business. And we have a very large office out in Hawaii. And that office out in Hawaii really kind of takes care of our Taft-Hartley business. So certainly a really robust organization, but again, predominantly domiciled here in Folsom. One of the things we pride ourselves on is being part of the best places to work. We're one of the largest employers in the Sacramento Valley. And this is a big thing in today's marketplace where there's a lot of turnover. So as we think about the groups that we service, the groups that we manage, there's quite a bit of complexity sometimes that comes with that. So having a team that's part of the integration process, and that team is then carried forward into the management of that group, is very important. Our average tenure now is going on upwards of 10 years. And so that's kind of speaks to why we retain and vast majority of our groups compared to the industry. Going on to our accreditations, certainly we have many of them. The one that we sort of pride ourselves on is our PCI certification. And what that means to the audience is we're audited like a bank. There's only a handful of TPAs in the country that are audited this way. And the reason why that's important to the group is because data analytics, our reporting is by far above the standards of many TPAs. And so again, there's that old kind of concept of garbage in, garbage out. If we're managing good data and we do it well, that means the reporting we're providing to our client is accurate, and there's never a question of, well, why is that on the invoice or not? So certainly want to kind of bring that to the attention of the audience. What I wanted to represent on this slide here is a full suite of products that we offer, right? There's a lot of TPAs out there, for example, that might just do the medical administration. And that's okay. But we've learned in 30 years of business, the more that we can manage for our client, typically the better, right? So if we can come in, not only take care of the medical administration, utilizing top tier networks, but also helping with the stop loss coordination, the PBM coordination, having a care management team and nurses in-house to help with kind of white glove complex issues with large case management, going on to kind of administering the ancillary lines, such as the dental, the vision, the flex, the COBRA, so on and so forth, is very empowering, right? Because we think about through a lot of acquisitions that happen in the TPA space, oftentimes their technology and reporting isn't connecting easily, which is causing a lot of angst and a lot of concern out in the marketplace. So the more that we can manage helps us in the fact that to the extent there ever is an issue that occurs, we know exactly where that issue occurred and know what we need to do internally in order to kind of help remedy that situation, versus a drop ticket environment where other TPAs might take several weeks or months to kind of figure out where the issue occurred and what needs to be done in order to fix it. Wouldn't mind going on to the next slide, Dave? So going above and beyond, I really wanted to incorporate this slide because if we think historically about what a TPA did for groups, there was paying medical claims, right? And as the industry has changed, right, TPAs are doing more than they ever have in the past, and the demands are higher. So I wanted to bring a few things to light that I thought were distinguishers upon BRMS relative to our competition. First thing I'd like to notate is the front-end claims experience, or claims administration, I should say, excuse me. And that is, Historically, TPAs have worked off this auto adjudication model, and they used to pat themselves in the back with, hey, we auto adjudicated a claim, meaning they really didn't look at it. They just paid it quickly in order to kind of drive up how quick they can turn around a claim. The truth is, that model is sort of a dying model from our perspective, the fact that, a claim is being paid without being looked at, meaning that there's a lot of errors that can occur in that model. And in that old model, it's kind of that pay and chase model where you're going down and you're having to kind of do an audit of the claims that have been paid, and you're kind of realizing, hey, how much have been paid in an error? And then you have to go out and recoup those funds from that provider that you otherwise have overpaid. What we're doing on our end, and we look through AI technology, all the invoices are coming in-house, and instantaneously, there's a code that's being, on that invoice, and it's the computer software is looking at, is it fair? Is it reasonable? Is it accurate? And what we're looking at now is 100% of our claims are being viewed. We're running at a rate of 98% accuracy, and our turnaround time is about 6.3 days. And compare that to any of our competition, we exceed all of them, and our satisfaction rate is very high. The other thing that we've done a little bit different is we now have an in-house pharmacy consultant team. And we think that's very beneficial because many of you have been in the self-funding space. Pharmacy can be very challenging, right? And it's all of the devils in the details. It relates to the contract, the language, the terms. And unless you're in that space every day, you might think you have a good contract. But now we have a team that kind of goes through that and is a complement to both the advisor, the client, and BRMS, to making sure that, again, they have the best program in place, offering the best rebates with the steepest discounts out there. The other thing that I like to highlight is our dedicated team, right? Whenever I'm looking and interviewing a new client to see whether or not it's a good fit for BRMS, 9 times out of 10, wherever they're coming from, if they're already self-funded or considering going self-funded, it's about, hey, what kind of support do you have to help manage our group, right? And I like to highlight to the audience that we have a dedicated service team that comes in during implementation. So the time that one of our groups goes live, the client, the HR team we're working with alongside the broker, understand who their AA is, the client management team that is supporting them, the billing representative, right? So that, again, the time the group goes live, everyone understands who each other are in that kind of matrix. They understand who to go to when there is a potential kind of question about something. And so nothing falls on deaf ears. You're not having to call into a service team each time to kind of redefine the situation or question or concern. The last bullet point is data and analytics. We pride ourselves, again, being PCI certified, on having very, very accurate data and analytics. A lot of TPAs say they have it. I think that's one of the benefits of being self-funded, is kind of owning the analytics of the group that you service to understand what can be done and what can be changed to improve upon or lower the medical expense within a self-funded plan. We have hired on data analysts that comes in along with our technology platform to understand what the data is, to make sure we scrub it so it is very, very accurate. And not only that, but going from a review perspective with our client, these groups can be professional extension of the brokerage arm. And that is, hey, going in, understanding, hey, what is the data and what sort of actual items can we do, again, to improve a medical plan's performance by driving down spend. What you'll hear today is BRMS is very, very big on technology. Right. And so we have built our homegrown benefit administration system. And by and large, what we're seeing kind of in California is a lot of transitional groups going from fully insured to self-funded. In doing so, they're needing a ben admin system. Now, of course, you don't need to use ours. There's a lot of payroll vendors out there that might say they do this well in other ben admin systems. So the truth is My Health Benefits is one of the first ben admin systems there was in the market. Certainly, there's been a lot of abbreviations of it, like most technology platforms, but the neat thing, what you're going to learn here today, is the fact that our benefit administration system was built around self-funded clientele. And this is the same system that our account executive and our accounting teams all work from. And so there's a lot of efficiencies that come along with utilizing our system. Now, we've learned through being in business for 30 years is the fact that we have to adapt, we have to modify, we have to have our pulse on the industry, right? From a technology perspective, vendor perspective, cost containment perspective, to making sure that we are relevant within the brokerage community and the clients that we serve. And so to the extent that My Health Benefits was used or is being used by our groups, this automatically gets fed into the HealthJoy system. And what we'll see here throughout Dave's presentation is that whatever the employee elects by way of benefits, this through online enrollment, this automatically gets fed, EDI fed daily into an updated daily over to the HealthJoy system. And so what you'll see is a kind of a wallet sort of kind of application to where whatever an employee chooses on our system, vision, dental, medical, HSA, FSA, automatically is updated into that HealthJoy system so that each employee is going to have their own unique tile and benefits wallet. So here's some of the features. Again, Dave's going to go through here throughout his presentation. But in process of transitioning, what I wanted to kind of represent to the group is HealthJoy has come live to the market in January of last year. So this is 2022 on their TPA Plus solution, right? We look at vendor partners out in the market to help us change and drive ROI for our clients, right? We are tasked with that at its core, with a TPA. And so since our integration with them, we have a strategic alliance. And I just want to do a sampling for the group and just, showing that what we brought to market by way of pilot is working and we are thrilled with it, right? So here's some of the stats that we've seen. Most of these groups went live just after July of last year, and we're growing, right? So I would think the majority of our groups, particularly around Pareto, in groups that are looking for a front-end good experience, this is something that almost is included with every sale that BRMS is included today. I would also think and submit to the group out there that, if you're thinking about going up market, this is a wonderful tool for you to kind of represent. That's going to be a distinguisher that, again, BRMS, I think, is one of the only handful of TPAs within the Pacific Northwest that have access and are integrated to the extent we are with this team. So that in mind, I'd like to transition this over to Dave. Dave is the EVP of Strategic Partnerships throughout the United States. Again, he's prepared to speak about 35 minutes or so. And throughout that, again, if there's any questions, I'm sure the audience will have, we'll go ahead and kind of take those towards the end of the call.
Awesome, Bill. Thanks. Let me first ask you, can you hear me loud and clear? The mute is unmuted, correct?
I can hear you fine.
Perfect. That means everybody can. Well, thank you, everybody. I don't want to be redundant in Bill's introduction, but I think it's important to say I truly appreciate everybody carving out some time to spend, the 45 minutes or so with us today to learn more about not just BRMS, not just HealthJoy, but what we are doing together that's truly revolutionizing the healthcare space. A lot of familiar names on here, some very unfamiliar names that I'm excited to get to know. But for those that do know us, you've seen us change quite a bit over the last, call it 5 years. I've been with HealthJoy for just over 5.5 years. And one of the biggest reasons I came to HealthJoy to begin with was the technology. I've always been in healthcare. I started off in the wellness side, loved what I did from early detection and prevention. I think it's a critical piece to any benefit plan. But there was always a lot of frustration when I go side by side with partners to renewal meetings of, despite all the great things we were doing and impacting, healthcare costs were still going up. I ended up leaving and going to a health plan where it started incorporating a lot of these other like point solutions, right? Integrated telemedicine, concierge type services, transparency products, everything that you all come across in the marketplace that we continue to hear as these buzzwords in business segments. So it was bringing all these together. And that's where I started having my eyes open of, man, there is just a lot of opportunity here to get in front of. But the one thing that was missing was technology. And that is one thing I wanted to get into. What really piqued my interest about HealthJoy when I came across them was we are a technology first organization. And I say that to say we are not removing the human element. There's a lot of care navigation. It's probably the biggest buzzword in our industry and the largest, fastest growing segment in our space. But what we do differently than anybody else is we lead with tech. And you'll see why that's so important as we go through this. But as I said, not removing the human element. We have a team of over 400, of which about 200 to 250 of those are live human concierges, giving you all the confidence and support that there is a live human touch aspect to all this to help members understand what is going on, what they have access to and the like. But everything that we do at our core is really focused on these 4 pillars that you're seeing here today. How do we control healthcare costs? I hate to be cheesy here, but there's so many point solutions out there, and what everybody in this call is tasked with every year of vetting out solutions. You're getting bombarded by new companies about what's new. There's a lot at stake. And we hear loud and clear that despite these cost containment strategies that are, in theory, make sense, right? Built to mitigate risk, control cost, it's really hard to drive activation, awareness, and engagement in them. And that's where we thrive. And the reality is, to lower healthcare costs, you need to pay less for healthcare. That's the reality of it. Despite whatever solution you have, you just need members to have a tool that's in their hand that's going to allow them to make better healthcare decisions. And technology is able to do that very easily, scalable, and very flexible. The second is, how do we increase benefits engagement? Meaning you have multiple benefits programs that are a part of it. And as Bill said earlier, every administered plan that BRMS has, we get fed that. So when a member is in there, they opt into different programs. We are there top of mind to help educate that member on the benefit, guide them, connect them, and make sure that they are actively taking action in those, executing on those strategies that you've worked so hard to implement. For the HR teams on here, the brokers that work with HR, I commend you. What you're all tasked with every single day, I don't know how you do it. The multiple hats, the being strapped thin, growing organizations, thinking about this. You are the front line of an organization. And what we do is enhance everything. We're trying to be an extension of your HR team. How can we help reduce the amount of very common questions that, let's be honest, probably a lot of you are receiving right now? It's 1-1, open enrollment's done. Things are rolled out. You're probably getting bombarded with questions about, where's my ID card? What do I do here? I forgot what I have. How can we help reduce the amount of questions you're receiving that HealthJoy now has access to educate that member on your behalf, so you can really focus on more business critical things? And then the last is improve employee well-being. A lot of stress out there. How do we make healthcare simple? How do we make it easy? How do we do all the heavy lifting for that member so they can focus on what's most important, their health? We will do all that, and everything that we do and everything that we talk through as we go through here is really focused on that member first. So at our core, I'm going to just get right into this. Sorry about that. At our core, we are focused on simplifying benefits, centralizing all benefits into one mobile experience, being the front door with technology. We have built out a very proven concept over the last 5 years. If you have a good experience with something by a click of a button, think about Amazon, Uber, Netflix. You have an app for something. You go to it. Why? Because it's easy. It's convenient. A click of a button, I'm guided through it. I'm provided recommendations. It basically tells me what I need to do, and I don't even have to think. And it's really become second nature to our life. We haven't had that experience in healthcare. And that's the opportunity that we saw in what was our core thesis when we started the organization in 2014. If we focus on the member experience, people use things. If you have a continued good experiences, members use it more and more. And that's when you start developing this muscle memory. So ultimately, when we are a part of the benefit program, the cost containment strategies like BRMS, we become a part of that, and we become that first place members go to, and then we can be the conduit to get them connected to the appropriate care program or resource. That's what we've done incredibly well. Why we partnered with TPAs, we knew we'd get to this point, and you're staring at this screen to say, okay, what's the point of this? And I'm going to tell you. We wanted to partner with TPAs because the power's in the data. You all know that. There's a lot of data out there, and there's always this question of, now what? What do we do with it? And there's been a lot of strategies out there that try to accomplish it. Unfortunately, data may be delayed, it may be too old. You've lost that opportunity to truly impact the outcomes. Because of our strategic alignment with BRMS, we are now able to ingest this data to be proactive and help insert ourselves at the point of delivering care to the member, to get them aware of what their options are so they can make a well-informed decision. Make that first decision the right decision. Now, why is all this so incredibly important? When you start breaking down overall healthcare costs, and I know this is nothing new to you, but I always love just looking at the visual because it's like this light bulb that goes off. You break down overall healthcare spend. About 20% of that are your fixed costs, right? We all talk about it. PPO access fees, admin fees, all the fixed costs where we try and nickel and dime a penny or two or a PEPM or two. We get it. You have your fixed costs. The reality is the majority of your healthcare spend, the 80%, are your variable costs, right? Claims. This is what that's looking at, the 80% of your variable. And you dissect that even more. You have 60% of your standard services, 30% are planned in inpatient, outpatient hospital services. And unfortunately, about 10% of that are emergency. Unfortunately, things that you just have no control of. And I'm sorry about the animations here. But what that 90% is showing is that 90% of those variable costs are planned, controllable events. And think about that. 90% of those claims, members have an opportunity to make a decision before they do anything with it. If you are able to put an easy way to access care, a tool that helps educate members on what their options are, what things cost, what the high value options are, and we can inform them of what that is. Oh, and by the way, say, we will hold your hand every step of the way thereafter so you don't have to do anything. That is how you start changing behavior. That is how you start changing outcomes. And that is why we were so excited about BRMS. And as Bill shared, what they do is so unique in the market. You know, we are agnostic at our core. We work with every carrier, vendor, platform, solution. We have over 1,200 clients today. The reality is what they are doing is so unique and different, trying to build things in-house. They've truly elevated themselves in the marketplace because they are the thought leaders. They're making change. They're growing because they have proven what they've done is everything that an organization wants. And we are thrilled to be a partner with them because one of the missing links in healthcare truly is the care navigation. You need something that overlays on top of all of this, where members have one place to go. And for HR, right? How many different point solutions, mobile apps, websites do members have? How many different telephone numbers? Members get confused. We understand that. That's our main opportunity to drive change is how do we simplify that fragmented experience? How do we bring it into one? And then we are the one that says, here are your options, and being able to steer them to an option that they might not have taken advantage of. So what we are doing with BRMS is taking all that they've built, all the networks, all the plan designs, everything that they are administering, and ingesting that information into the experience. And then we marry that with the eligibility to create a personalized app experience for each member, spouse, and dependent. So by a click of a button, members access all their benefits right there. They're educated, they see it, and then they can start asking questions, or we now have access to the data where we can proactively engage them. Now, I mentioned technology. That is our core. And that's what makes us different. You hear loud and clear from a lot of carriers, other TPAs, even brokers and consultants. Oh, we have an app too. That we understand that. I think this is just like the wellness was when I started in healthcare, the wellness side. It was, we're checking the box. We're implementing these programs because we know we need it and we're just checking the box. Sure, there's great benefits to some of those things, but is it truly making change? Is it truly a good experience that's driving the outcomes and the results that you want? I would challenge people to think about that, because the reality is, I don't think it is. And the activation and utilization we hear loud and clear are very low single digits. Imagine if you had a solution that was able to engage on average about 70% of your eligible population and do that every single month. Imagine receiving and having the ability to send out push notifications to stay top of mind throughout the entire year, HR, right? It's not just open enrollment. Imagine if you had a continuous cadence to be able to proactively send out push notifications to remind members about upcoming benefits related situations. That's how you stay top of mind. And I'll pause there because when you think about the power of tech, and everybody's looking at this price saying, yeah, I understand push notifications. I have a cell phone. I understand that, Dave. Well, do we understand how powerful? Again, this has been part of our life. It's ingrained in our everydays now. The power of this is, last year alone, there were 10 trillion text messages sent to people. 10 trillion. 98% of those text messages and push notifications are read in less than 2 minutes. Yet less than 20% of emails are opened up, and less than 14% of phone calls are picked up without being placed on hold or shuffled around a call center. So my point is, continue to rely on the ways to communicate and educate the current population through emails and cell phone. But if you really want to be able to engage people and stay top of mind, the technology capability of outreach and push notifications is the way to do it. So again, at our core, that's what we're doing through this communication strategy. Now, what I talked about, the unique difference of and the exciting integration with BRMS is ingesting that data. And I'm going to pause because I'm going to say this, and I'm the first to admit, everything that we do at HealthJoy at our core is still reactive. We just do it a whole heck of a lot better than most like companies in the industry because of our tech first approach. What do I mean by that? We still need members to come to HealthJoy in order for us to do our job, right? We do that and we have great results. Bill showed the preliminary results over the last couple of months. We're driving that. But now imagine if you had the data where you don't even have to rely on members coming to HealthJoy. What does that mean? Well, the data we receive and continue to receive and will continue to build out to make it even more robust and more opportunities into the future with BRMS is the data. There's opportunities in the beginning with insurance verification. What we're really focused on with BRMS are really the claims that matter right now, the pre-certification and pre-authorization files, right? Something like an MRI. Or at the point of a procedure where a doctor, in this case, a member needs a knee replacement. These areas, and when you see the arrows, are opportunities during a member's care journey that we now have access to data that we can now proactively reach out to this member to say, hey, we understand you're doing something. We understand that you have an MRI. We want to let you know that we've already done research because we have the pre-cert information. We know what it's going to cost, where it's at, and when you're going. But we found there's a better option that's still in network right across the street. Availability right now, we can get you coordinated to go over there. It's going to save you $1,500. What would you like to do? Or at the point of the procedure, how can we give that member education and information about all the metrics, not only of the facility and or the hospital, but what about the surgeon? Did you know that this surgeon performed this procedure 5,000 times? There was no readmission rates, no post-infection disease rates. Here's all the reviews on all these multiple websites from an actual person that saw them and what they thought. Employee, we want you to have information at your hands and your fingertips so you know that you are making the best decision possible. Oh, by the way, here's some potential cost savings. So it's a win-win-win. Again, the data allows us to be proactive in a care journey throughout the entire year. And I can tell you, when you have that opportunity, that's how you start changing behavior, and that's how you start driving outcomes. And I want to share this because this is a true life example in what we're trying to accomplish here. This was a member who unfortunately needed a brain MRI. Okay. And what happens? Sees the doctor, let's get you scheduled, have all that done. This is now part of the pre-cert process. So BRMS is now sending that file feed to our team and our concierge. Our concierge team is looking at that and then starting doing the research to say, hey, is there a better alternative for the plan and that member based on this MRI? And in this case, we actually found a standalone facility that's going to save $709. We shared that result. The member said, heck yeah, love to do it. Got them coordinated, had it done. Results were shared to the doctor, continued their journey. Showed incredible value to that member, had a great experience. Now, where I go, I kept saying experience. Why that's so important? Because if you have a good experience, you're going to create great muscle memory. And in the future, when you do need something, what's going to happen? That member's going to know to go to HealthJoy first. And that's exactly what happened here 3 weeks later. Unfortunately, that same member needed a brain CT scan. What happened? Doctor scheduled it before, in this case, Joe did anything. He said, I'm going to go to HealthJoy. They helped me last time. It was great. I saved money, had a great experience. They just made everything simple, and I understood it. That member now came back to us, and great news is we found another savings opportunity for the CT scan of $720. So again, value to the member, number one. Value HR leaders on this phone. Imagine that type of a value add from the benefit strategies you put forth in the hands of your members. They're going to make you, this makes it just a wow, I would hope. You see the value in it, what that means to you as an HR leader. And then the bottom line, the business, the plan, savings opportunities. And like I said, the only way that you're going to lower healthcare costs and pay less for healthcare is by paying less for healthcare. That's how you do it. The last opportunity, that was part of the initial care journey where we're receiving the data where we can now be 100% proactive. What about, and Bill had talked about this, the disease management, utilization, and case management programs that are in place that unfortunately members that should be actively engaged in clinical specialists to help manage the condition they're not taking advantage of it. Why? Do they know they have it available? Do they not understand it? What is it? Is it because they can't reach the member because they're relying on the old ways of communication, i.e. phone calls and or emails, and that member's just not responding? There could be a number of different reasons. Well, the great news is we're now getting those file feeds that basically say, hey, HealthJoy, here are the members that our team needs to be engaged with. We just can't get a hold of them. Well, we now build that into our workflow. And obviously, like I said, the power of push notifications. We are now able to reach out to that member, tap them on the shoulder, educate them about the value, the impact, and now bridge the gap to drive these members back into those resources that everybody knows that are valuable, that they're not taking advantage of, and bridging that gap. It's incredible. So I'm going to pause, Bill. I know these are two specific examples of BRMS, but if you want to share some kind of highlights on here on that value, I'll let you kind of take it from here on these two.
Yeah, I mean, there's two really, there's a lot of examples we can share, but the way that we look at it is cumulative savings, right? I mean, let's say, for example, the average group we worked on last year was over 250 enrolled. And we start looking, collectively as to the savings involved. And here's just one example we kind of pulled out with a person needing a total knee replacement, right? Each and every one of us gets a referral from our doctor. The truth is I think we can all question ourselves and say, I'm going to that specialist or that doctor because, I'm banking on, my primary care physician, for example, sending me to the right place. Truth is I don't, I wouldn't know how to go and review how many surgeries that specialist has done. What is the remittance rate? How long have they been doing it for? So on and so forth. And so here's an example to where exactly that, there was a referral originally proposed. A pre-cert went in, the HealthJoy team came in, evaluated, had the opportunity to consult with the member. Again, it was a 69-year-old construction worker here in California. And saying, hey, rather than going to that doctor, go to this doctor. And by the way, this doctor has been doing it for 20 years. And so ultimate being, there's $18,000 of savings that the plan realized, right? And kind of going back to kind of law of averages, if we've got, a bunch of people with an average utilization rate trending 70%, we start seeing huge savings to plans. Here's another example to where, someone need to go in and get a cyst removed. 55-year-old, in this case, again, HealthJoy got involved, consulted, and in this case, saved the plan another $5,000. With the doctor has been, it was closer to the employee's home. It was below the healthcare cost, and the doctor we sent him to had 10+ years of experience doing this. So the employee had a tremendous and favorable outcome, and the plan also had quite a bit of savings.
Perfect. Thanks, Bill. Yeah, that's I can't stress enough how exciting this relationship is. And I'll say this too. I could probably spend an hour to 3 hours talking about everything HealthJoy because of our technology and the capabilities. Again, for those that know us, you know how robust we are. That those that don't, we'd love to spend more time and really walk through the core functionality of the app experience, because there's a lot that we are not covering today. But really the point, as Bill said, get you understanding high level who we are, what we do at our core, but more importantly, why we're here today as a partner, not just another vendor, a partner that's integrated, invested heavily, and built something very unique that the marketplace has been craving for, that has been proven out to impact all aspects of the business, from the bottom line, HR burden, simplicity and access to care, and obviously the big one, right? Lowering healthcare costs. So again, this is a big opportunity for everybody that's on this call. But simply put, this is allowing us to take a historically reactive approach to healthcare, flip that on its back to make it proactive with opportunities through data. And that is great, because when you have access to data, it's providing you even more visibility and insights, which hopefully the exciting thing on this call is think about what we can do in the future, right? This is iteration 1, which hopefully people are thinking like, wow, this is great, or at least it's better than what I have now. But imagine what we can do. And that is part of what this collective partnership does today, is allowing us to build something. There's dedicated teams and support teams to walk through everything, how the program's performing, because it's all about driving outcomes. There will be real-time access to the data, so you can see the visibility. How are people accessing HealthJoy? What are they looking at? These are opportunities we can all get together to sit down and say, wow, it looks like 50% of the population are the dental part. that maybe this is an opportunity we should start promoting more about the dental benefit. Again, it's going to provide more insights because you all work, everybody on this call works so hard day in, day out, all year long to provide a benefits plan to the members. You want them to use it. You're investing in it. You want them to use it. We are that ability and that technology that overlays on top of it all to ensure that they are. And that's what's exciting. And I'm going to end it with this before we pass it to Bill and then maybe some questions, but why our relationship is so unique. Again, we are agnostic. We do integrate with a number of TPAs across the country, but what we are doing with BRMS is truly unique in the entire country. Because BRMS, as you shared and Bill highlighted, and I know he could dive even more into it, that's why we were so excited to partner with them. You could tell they're innovative. They look at technology as an opportunity. They're looking at ways to get bigger, better, faster, stronger, and they know that care navigation isn't just a nice to have today, it's a must have. Every company in the country should have some form of a care navigation platform. And they believe so wholeheartedly into it. They truly have made, both of our teams have made significant investments to make this a platform that is truly included in their overall cost containment strategy. Together, we've built this, the easiest and quickest platform to implement. And hopefully those on the phone, it's a breath of fresh air, right? We don't want you to think that, oh man, here's yet again another thing I'm going to have to implement. We've removed that. There's dedicated teams to do all the work for you. Because of the seamless integrations with BRMS's team that's focused on those administrative plans and the platform that Bill shared, that's just ingested electronically through the feeds. We get all those, right? The other great thing is it's billed and administered through BRMS. There's no client contract needed. So we don't have to worry about legal. It is everything because it's part of BRMS's strategy. There's an entire dedicated team to ensure proper delivery of the program, HR to help you promote the heck out of it, to make your lives easier, to ensure members know they have it, how to use it and when to use it, and then making sure that we're executing on the strategy. And then again, as I said, this partnership allows us to do all these things the quickest to easy to implement. No contract needed, so we can just get groups going ASAP because that's what we want to do to proof that concept and get the data to start showing those outcomes as fast as possible. But we're going to have even ongoing, more robust reporting so we can continue to make this better, more robust, and we have more opportunities to drive change. So incredibly excited. Bill, I'll pass it to you, but before I do, I'll just say thank you for your support, the leadership, your entire team. I know we're excited and we know we haven't even scratched the surface, but next week's going to be fun when our team's out with yours out in the market, getting out in the field, talking about this. So thanks everybody. Looking forward to it. And Bill, I'll pass it to you for closing remarks.
Yeah, thank you. Charlene, has any questions come in?
Looks like we don't have any questions at the moment.
Okay.
We knocked it out of the park, Bill.
Well, good, good.
No, I'm just kidding.
Well, again, collectively, BRMS wants to thank everyone for joining today. Again, we were thrilled in 2022 with our results, proven track record of how well we worked as a team and the value that we're bringing the broker community and our clients. We're equally more excited about 2023. Again, our pipeline is growing, our company is growing, and so I always kind of help managing the sales team. I'm looking at our successes by way of, again, the feedback I'm getting from the broker community and our client, but also the repeat business that I'm getting from the broker community. And, I find value in building relationships with everyone. And so when I'm seeing brokers come back and say, Bill, what we just went through for a group and during implementation was a home run. In fact, I've never experienced that before, and say, hey, Bill, I've got 2-3 more cases to work on. That's a barometer that I work from to value to see whether or not we're making an impact to the broker community. So when I'm seeing that, I'm thrilled. So again, I'm ecstatic about the relationship. Again, there was a plug that David just mentioned ago about our roadshow. We are meeting with several market leaders within the Pacific Northwest about what's new at BRMS. Let's talk about the strategic alliance of HealthJoy and BRMS and the impact that it's making. And so to the extent any of you would like to meet, happy to kind of loop you in on that. Again, I think there's going to be some other visits that we're kind of planning on in the future, so we can always plug in on those as well. Finally, what I'd like to mention is BRMS, in conjunction with Teladoc and HealthJoy, are putting on a March Madness event at the King Stadium, where we'll be having the opportunity to kind of do kind of a slight presentation before each of the basketball tournament events to kind of give a perspective of what we're doing and giving some more live examples. So to the extent any one of you would like to participate in that, please email me. That being said, again, we're kind of at our mark. Thank you so much for everyone. We do have a list of attendees, and likely, David and myself will be reaching out to say thank you, with the goal of hopefully to, again, get in front of you and just, kind of share our message and story again. So with that in mind, everyone have a wonderful rest of the week. Again, Happy New Year, and we'll be talking soon.
Thanks. Have a great one, everybody.